Hi there. Healthy Kids, Healthy Life is a nutrition-based public health initiative which aims to reduce the prevalence of diabetes of those living in low socioeconomic rural communities in Australia. Type 2 diabetes is classified as a national health priority. Disturbingly, the development of type 2 diabetes in children is increasing. When diabetes manifests, children's concentration is decreased, seriously impacting their ability to learn and thrive. It is beneficial to prevent type 2 diabetes rather than treat it once it has already manifested, as it is an extraordinarily large cost burden on the public health system. Diabetes complications added to nearly $1 billion overall health expenditure in 2004. Children in rural areas are at an increased risk of disease development due to lack of services and support. The term rural applies to all areas outside of Australia's major cities. A significant proportion of the target population will be Indigenous students, as in 2016, 39% of Indigenous people were living in rural areas. Indigenous Australians are 3 times more likely to develop diabetes than non-Indigenous Australians. In addition to this, type 2 diabetes occurs earlier in their life. Those living in low socioeconomic rural communities face unique challenges to the rest of the Australian population due to limited access to resources including food, education and healthcare. Additionally, low opportunities for employment and a reduced income put strain on their ability to purchase these resources. This intervention will provide communities with resources such as education, food, sporting equipment, and medical care. This program aims to prevent the development of diabetes. Introducing healthy eating habits early is key to preventing adulthood diabetes. Prevention is much more cost-effective for both the individual and the government rather than the treatment of diabetes. The program aims to improve food literacy among students, increase fruit and vegetable consumption whilst decreasing refined sugars and saturated fat consumption. Lastly, the project aims to improve energy levels, learning ability, and overall health status of the children and wider community. Each practical lesson will educate the students on a new topic. There will be no one-size-fits-all approach. The program will take the values, beliefs, and individual resources of each community into consideration. For example, communities with a higher prevalence of Indigenous students will have practical components where the elders come in. A large component of the program will be based around growing, cooking, and eating real, nutritious food. Breakfast will be supplied each morning the program runs to ensure the children are properly fueled up for a full day of learning. All canteens will be required to eliminate options high in saturated fat and refined sugars by December 2020. Healthy options such as fruits, vegetables, whole grains, quality dairy, lean meats, and low sugar drinks will be introduced as a replacement. There will be a strong emphasis on physical activity as sedentary lifestyle is a risk factor closely associated with the disease development. Free health checkups will be provided throughout the program as statistics have demonstrated that those living in lower socioeconomic rural communities spend much less on healthcare than the rest of the Australian population. To determine whether students are meeting the objectives, teachers will be required to document all participation and progress via a national database. In order to identify areas that require improvement and extra attention, there will be quizzes throughout the sessions. The children will have incentives to complete these quizzes as there will be prizes such as skipping ropes, footballs and basketballs. To ensure the schools are following the canteen guidelines, there will be random school visits at any time whilst the project is running. To measure whether the project has made a noticeable difference to the health, there will be checkups at the beginning and the end of the intervention, and in these checkups there will actually be blood sugar levels taken, and that will also be added to the database, and there will be an incentive to attend these checkups as they will be free to all family members. Thank you for listening.